Oh, hi, Anne. Welcome to Injectual. I'm Joelle. I'm the founder of Injectual. Injectual is an aesthetic clinic and we highly specialize in gender-affirming care. We started 3.5 years ago, so I started the company together with my sister, who's a plastic surgeon. After transitioning myself and having undergone like multiple plastic surgeries and treatments and skincare, that had such a transformative effect on me that I wanted to explore working in that area. And also I always had this vision of like starting a company with my sister. That I started working in this industry and actually really enjoyed it. You make people feel so confident. There's always like new technologies, new things to learn, new ways of doing treatments, and you make people feel beautiful and affirmed in their gender and affirmed in their life and more confident every single day. So it's just very, very beautiful to me. What's most important at Injectual is that people enjoy their entire experience. It's not just a transaction. We want people to feel comfortable. All of our consultations are free. We have packages, memberships to make premium injectables as affordable for everyone, because I want people to really enjoy the experience. We have a gender-affirming care guide for all of our stuff. I want my practitioners and my people that work for me to really want to do the best for gender-affirming care and be passionate about it, because you feel that as well, right? Medical transitioning is already such a vulnerable process that you just want that to be as comfortable as possible in a safe place. It can be very, very small changes, like 1 ml or 0.5 ml of lip filler can have such a transformative effect on your self-esteem and confidence. But also, we will never force you to have treatment. Come have a chat, we will give you our honest advice, but don't feel pressured as well. We want you to go home and think about it. Our consultations are free of charge. See how you feel afterwards. There's absolutely no pressure. Wherever you are in your journey, we will never judge you. We've seen it all. I think it's just really important that you're at a safe place where you can just feel comfortable and just tell your story, and we will listen and we will give honest advice wherever we can and treat you with the utmost dignity and respect. We call our gender-affirming care service Transjectual, which we're also currently developing into becoming its own location and also setting up a fund. The one area that we don't do is actually hormones, and healthcare is obviously specialized in that. No matter where you are in your journey, we offer services for everyone, whether you're just starting out or whether you're a seasoned doll. For all gender expressions, we offer basically services for everyone, but we don't just offer it, we're also specialized in it.
My name is Zain. I'm one of the lead injectors here at Injectual in Shoreditch. I have been injecting for 5 years now, which is very exciting. I have a master's in pharmacy and prescribing, and I've also done a diploma in full facial anatomy and aesthetic. I specialise in the facial feminization treatments here at Injectual, and I also specialise in a lot of the regenerative skin treatments too. So when we're looking at injectables, we're looking at different layers of the skin. Ultimately, it's not just kind of one in, one out. We have different layers which, when we inject into certain parts, they do different things. We have products that work within the muscle and reduce, for instance, a downward pull to lift and elevate parts of the face. They also work to relax certain muscle groups too. We want it to be beautiful, we want it to be elegant, and we want it to be undetectable, so the only person that really knows that you've had something done is you. We see patients later on in their transition, or we see patients earlier on. We can help you achieve your goals, and we've seen patients have such beautiful results. So regardless of where you're at, we want you to know this is an inclusive, safe space, and that ultimately we just want to be a helping hand. Sometimes the facial muscles, like the procerus, the corrugator heads, the corrugator tails, they can be quite overgrown. When we're treating them to lift certain parts of the face, you can get a little bit of an illusion of a reduced brow bone appearance sometimes. We can also strategically place a product within the corner of the eyebrows if you want a bit of a lift as well. That's something that can be achieved. The trapezium muscle is quite bulky sometimes. So when we're doing feminizing, we're looking at relaxing that and creating a more elegant, lifted appearance, which traditionally is a little bit more feminine. When we're looking at dermal fillers, it's usually dependent on what the patient would like, but sometimes it is a case of some patients don't know and they want us to help guide them. Traditionally speaking, feminine features sort of fall into this sort of sweet heart-shaped face. Imagine like a heart, right? We've got lifted cheekbones, we've got a pointier chin, we've got less bulk on the corners of the face. We can sometimes replicate the idea of like a lip lift through injectables now. At Transjectual especially, we've all done advanced training. Surgical interventions are quite scary, they're expensive, and sometimes it's not something you have to do one or the other. You can sometimes explore dermal fillers, skin boosters, and I think you'd be pleasantly surprised with what we can actually achieve now, especially in this age and especially at Transjectual. After the Supreme Court ruling and the EHRC guidance, we've seen so many patients come to see us in clinic. Patients are scared of being singled out, they're vulnerable, they're nervous, and they shouldn't have to feel like that. We've been giving them treatment plans that have been essentially just making them feel safe and confident. We never want anybody to feel, anxious just for being who they are, and ultimately, my goal is to just help somebody feel the best version of themselves. I like to get to know my patients. I like to know what their stories are, what brings them to the clinic today, what they like about themselves, and what they'd like to potentially alter slightly. When I got into injectables and joined Transjectual, I found that the work that I was doing specifically for the trans community was so rewarding. I go home and I think, you know what, even if it was a long day, even if I maybe skipped lunch or didn't get a coffee, seeing that satisfaction come from patients and also seeing messages from them too later on after a month, after 2 months, it fills me with such joy. I love seeing my patients see the results that they want, but I also love being within this quirky team.
My name is Tony Fordham. I'm one of the senior doctors at Transjectual. I've been with Transjectual for just over 2 years now, and previous to that I worked in other aesthetic clinics. I've been doing aesthetics for about 8 years or so, and alongside that I was a surgeon in the NHS for about 10 years. So the mainstay of our masculinization treatments are usually to create structure where there isn't structure. Typically in trans male patients, this is treating the jawline and the chin or the mid-face to create more structure there. You mostly will do that by using dermal filler, which are hyaluronic acids, in order to replicate bone or muscle. Sometimes we may offer certain other treatments in order to change the shape of the nose or the brows in order to give a more masculine appearance. We will typically give an overview of what treatments are available from start to finish for everybody, and then we may hone in on a couple of things that may be suitable for that patient in front of us. Even though we talk about masculinization procedures, it doesn't matter because not everything may be suitable for that patient. Medical history, including their transition history, I always find really interesting because not only does it help me to build a rapport with my patient, to know that so they see that I understand where they are in their transition journey, but it helps me to angle treatments towards people. At Transjectual, centering gender euphoria as part of our process for the trans community is one of the most important things that we do here. We want to make everybody feel like they can come to clinic and feel as included and safe as possible. Trans male patients in particular find it hard to seek care. If they're seen as walking into a clinic, it's seen immediately as feminizing. So we're trying to reassure them that that isn't the case and that our door's open and they can come talk to us about anything. There's no greater joy than helping someone achieve gender euphoria because you're improving someone's quality of life, even if it's a tiny amount. Just seeing somebody walk out of clinic feeling more confident in their skin is one of the greatest gifts I can do.
This is our receptionist extraordinaire, Frances, who's a receptionist but so much more.
A question that I get asked all the time by new first timers is definitely if any treatment is painful, how long the treatment will take, if there is a room that can go beforehand or afterwards. It's definitely a safe space. Everyone is completely welcomed. Oh, busy! Yeah. If I had to describe Transjectual with one sentence, it would definitely be, it's busy doll. So book your appointment. Come in, let's have a chat.
We've been open now for 2 years. This is in lovely Shoreditch on Commercial Street. It's an incredible area, like we're next to Spitalfields. There's so much life here, which I love. This is one of the reading areas where people can come and relax. We have some magazines here, Paris Hilton's book, no drinks corner, CBD infused to relax everyone. Our amazing artwork. And this is my favorite area, the post-treatment room. And then afterwards, put some tinted moisturizer on and go back to work or wherever they are. So thanks, Anne, for stopping by. See you soon.